Today, we are talking about a disease that affects 100 out of 100,000 people. Multiple sclerosis. Let's see in detail to understand what it is. First of all, it is an autoimmune disease. Then it is a chronic disease. And finally, it is a demyelinating disease. So let's try to better understand what it is. Nerve cells transmit electrical signals, which are called action potentials. These signals travel through long fibers, called axons, which are covered with an insulating substance, the myelin sheath. In multiple sclerosis, the patient's immune defenses attack and damage the sheath, as seen in the drawing. When this happens, the axons are no longer able to effectively transmit signals. There is no known cure in 2021. Some drug treatments are available to avoid new attacks, but the prognosis is difficult to predict and depends on many factors. During an observational study, we could see that fatigue is the most painful ailment that patients experience. Also in the study, it was found that oxidative stress can play a role in axonal damage through the action of oxidizing cellular components. There is therefore a balance between oxidative damage and antioxidant protection in normal aerobic cells. Cytozeta focused its attention on the fatigue symptom. Fatigue has been defined as a subjective lack of physical and mental energy, which is perceived by the individual as an interference with habitual and desired activities. The treatment with the biodynamic supplements of cytozeta allowed to even desire a net increase of the biochemical parameters, correlated to the increase of the total antioxidant state. Our research was also published on PubMed, one of the best-known scientific literature search engines. Despite recent advances in immune-modulating drugs, drug therapies have proved ineffective, especially in the severe manifestations of multiple sclerosis. Among the complementary treatments, nutrition was considered a decisive factor in controlling symptoms. Although no special diet is associated with multiple sclerosis, the impact of dietary supplementation on the course of the more aggressive forms of the disease has been investigated in recent years. During the chronic treatment, the variation of these two parameters was evaluated using two dietary supplements rich in vitality, cytosine and ergosine. In conclusion, the results obtained confirmed the efficacy of complementary nutritional therapies to improve the quality of life of the patient with multiple sclerosis. Further investigation showed that the real disease is in the power plants, the mitochondria. These have the task of controlling the signals generated by the neurons to reach the motor neurons. If the vaccines poison the enzymes in the mitochondria, the motor neurons will receive altered signals, and therefore, the immune defenses to release the enzymes from the poisons will pierce the myelin in an attempt to free the enzymes from the venoms. This is the reason why conventional medicine does not yet have effective therapy. Find all the links in the description of this video.